Thanks. So yeah, happy to get started. So for those of you that don't know me, I'm Lisa Adams. I'm the um, Associate Dean for Global Health and Director of the Center for Global Health Equity, and a physician in the Infectious Disease and International Health section. And I'm joined here by my colleague, Tekla Coleman. Tekla, do you want to just briefly introduce yourself?
Hi, everyone. My name is Tekla Coleman, as Dr. Adams mentioned. I am the program manager, and I will be the one handling applications and travel and all that fun stuff for interns.
Great, great. And just a reminder, because I'm hearing some background noise, for folks to mute if you're not speaking. Great. Thanks. All right, next slide. So what I really want to do is talk about the funding opportunities for Global Health Summer internship experiences, let you know what exists at Dartmouth. And then these are quite similar slides to what I already presented at the sort of the rapid fire session that we did in the evening in the what used to be the Chilcott Lab. I think in my day it was called the Chilcott Lab. I think it has a new name now. Where we went, there was a discussion about all different kinds of things that people could do over their summer, for their summer between M1 and M2 years. And so I'm going to go through this with a little bit more detail, perhaps, but I think my slides will take 10, maybe 15 minutes. So it's really meant to be mostly a Q&A. So I imagine lots of you have questions, and happy to answer general questions, specific questions, anything in between. So next slide, please. So again, as I had stressed and always do, that this really is all about finding what are you passionate about? What excites you? What will you be excited to do this summer? What is something you've really been always wanting to do and haven't maybe had a block of opportunity or the funding to be able to do this? So that's why I say it begins with your interests, passions, your skills. What do you have to bring to the table as well? And I know you all have, many of you, lots of experience and background and skills that you can bring. So to take stock of those. So we're going to talk about two different models of internship funding, but I think it does also make sense to begin with thinking about a place or a project or an organization or a community or a topical area where you are interested in, whether that's maternal child health, whether that's global surgery, whether that's a more public health focused mission around clean water or sanitation, nutrition. Really, so many things are possible. So again, it's the first step is for you to be able to hone down what your interests are and where you might want to work, and then based on perhaps your background, your language skills, places where you might want, places that you've worked before, places that you haven't worked before, but that where we offer an opportunity that you think would be a good fit for you. And then if you are doing a build your own, it's about identifying a community responsive project. So if you're doing the build your own, you will identify the location, the host organization, a Geisel or other Dartmouth faculty advisor, and through your host organization and in-country supervisor. And then it's really all about identifying that community responsive project. This really should be something that as much as possible bubbles up from the local organization, local partners that you're working with, that is in response to an identified community need. If it's one of the ones that we have sourced, a project and internship opportunity, then we will have done that work to work with our local established partners to make sure that it is a community responsive project. And then you will work with your advisors here to help you build your project, help figure out together with your in-country partners, host country supervisors, and your advisors here, what's really feasible? What can I really do? And you really only have about 6 weeks, maybe 7 if you stretch it out. We do want you to be able to have a break on either end. So yeah, so figuring out what is feasible. I will say the number one challenge that I think students have faced over the years is wanting to do so much. You have lots of enthusiasm, lots of excitement, and many times a lot of the feedback that we're giving to people's proposals is this really needs to be scaled back. This is not feasible within the time frame. And many students have great enthusiasm, so they say, well, I'll begin, for a month or two before I'm actually in country, and I'll continue working on it for months after I get back. And that does happen. It's not that it's impossible to do, but to also be realistic about what your commitments are going to be on either end, wrapping up your M1 year, finals, et cetera, and then, returning your reentry, and then starting your M2 year, successfully. So again, that's where I think a lot of the advising can be very helpful. And also just sort of figuring out, again, what is, can help with sort of project design, if it's involving research. It may be assisting with sort of study design, with what kind of methods you're going to use if it's a research project. If it's a community development project, same questions. What are you going to be able to do? What resources do you have will you have access to when you're on this internship? So just again, lots of questions that I think your advisors both here and there can help you work through. Next slide. So as I said, there's sort of the two different models that we're talking about now. The generalized build your own, we abbreviate it as BYO, is one that we, through the Center for Global Health Equity and through Geisel funds, are able to provide funding for those internships. And that's, again, you identified the place, the project, the host organization, your faculty advisors, versus the site or project specific internship, which is administered through the Dickey Center's GHI, or Global Health Initiative. And that's where there's a pre-vetted partner project opportunity. So it's with one of our established partnerships. So two different options and two slightly different application processes. We actually modeled the applications for the build your own to follow the ones that the Dickey Center had already established. So the applications are quite similar, but there is a different process for applying for one versus the other. Next slide, please.
Sorry, could I ask a quick question, Dr. Adams?
Yeah, and please interrupt at any time.
So for the pre-formed projects, I was curious if there's a place that we can look for those, because I tried looking them up and I found on the Dickey website that they were actually due February 2nd. So I was wondering if there's an extension to that or if it's something different.
So yes, what you saw, and actually it's like Tekla and I were just on the site looking for the due date, but it sounds like so that was for the spring term application. So remember, the undergraduates are on a quarter system. So we decided to offer, it was a much more, I think, limited portfolio of opportunities, but because the undergraduate students haven't been able to travel, nobody's been able to travel. But the undergraduates have the quarter system. Some of them may have their spring term off, which would be from end of March to June. So you don't have that time off, as you know. So that February 2nd due date was for spring term applications. We were just talking about how, so those applications just came in, they're being reviewed as we speak. So now it's time to get the summer term, the summer opportunities posted. They're going to look very similar, I think, because many of the partner projects that we identified said they could take students in spring or summer. So I think if you just start looking at what was offered for spring term, they will be very similar when it gets updated to what's offered for summer term. And we talked about aligning, having a single due date, which I show later. It's March 25th. So that's the due date for it, which is why we wanted to do this now, because that gives you just under 2 months.
Right. Thank you for that. Just one follow-up real quick. So you said if there's going to be similar, I'm not sure if I was totally looking at the right place, but it looked like there were maybe like 4 different placements or projects. Are we thinking they're probably going to be also 4 for the summer, or will that list be a little bit more extensive?
Yeah, it'll definitely be more than 4. We were just looking at it quickly. I thought it had showed about 6 or maybe, yeah, about 6. And if you notice, some of them were had a number next to it where they would take 2 interns. So it may be actually 12 slots if each one was taking 2. So yes, it will be more than 4 organizations, and it'll certainly be much more than 4 slots. I mean, our goal is to, I think our cap is 17 of those internships, maybe 15. So that's the number, again, that we're looking to have that we can offer. Yeah, it's been hard because many countries are not in a good position to accept interns. So it probably won't be the full 15 to 17, but I think we would be looking for, more in the 10 to 15 range.
Thank you so much.
Sure. Any other questions before I go on?
I have a quick question. Hi, Dr. Adams. I was just wondering that you said that they were due, end of March. And I know this is, pretty far out there, so, I'm sorry for asking if you know the answer yet, but do you know then when we would find out or hear back from the process?
Yeah, no, it's a fair enough question. And I would say, we will aim to do the turnaround within 2 weeks. We haven't, because this program's been on hold, of course, for the last couple of years, we need to make sure that our faculty board, as you see the slide now, showing that for the Geisel internal funding option, the BYO, we have a faculty and actually staff are on it as well, board to help review applications. In the past, we've had student reps on it as well, including 1 or 2 that have been funded in the previous year. So we'll work on figuring out who might be available. The academic calendar has also shifted so much. So we used to always have a couple M2s on the board, but on the selection committee, but they're going to be already in or getting ready for clinical. So I hope we will be able to have students on that represented on that as this year. So if they're due on the 25th, we need to give people a week or 2 to review them, and we'll have to set up the selection committee meeting. We do try to do it all in one night, go through all the applications, so people will have read them, ranked them, and then we do our review. And I will say, I like the way that this has evolved. The way that we've done this in the past is that it's almost more of a conversation rather than you're accepted, you're rejected, accepted or declined. So you could expect to hear back from us something like, really like your proposal, really want to find a way to fund this. Here's some follow-up questions that we had. And then give you, time for people to respond to those follow-up questions and to work with you to make it an opportunity that, again, we think will sort of meet all the specifications for these opportunities. I can only think of one time where that wasn't possible, and that had to do with more in-country IRB issues. And then I can also think of one time where we actually said this project just really, we don't think it has merit. We have lots of concerns, et cetera. So we're not going to be able to fund you for this project. We didn't see that there was any way for it to even be modified. And the student came back and said, I really want to can I go back to my in-country partners and almost start over to come up with, and he did, and he came up with a wholly different product. We were skeptical. We said, sure, you can try that. He came up with a wholly different project, and it was spectacular. And we funded him, and he was able to execute it, and it was, I think, a successful experience all around. So that's sort of the two extremes. But again, so 2-week turnaround time is what we aim for, because everybody needs to start planning. And again, it's a rare instance in which we say this just is not workable. Now, having said that, we also have, a limited pool of funding each year. If we were to get double the number of applications, we've always been able to work with the number of applications that we've received, because we've only received anywhere between 5, 10, maybe up to 12. If we get, 20, 25 applications this year, then it's going to be harder for us to be able to fund everyone. But as for the last, I would say, well, minus the last 2 years, so the 3 years before that are fresher in my mind, and it's been more in the 5 to 6 applications range. So we said, why not try to work with everyone to get them funded?
Great, thank you.
Sure. But can you go back to the previous slide? Okay, so just some basic requirements here too. That it has to be a 6-week minimum in country, community responsive, community identified need. As I said, these are the numbers that we're looking at, right? We've been able to fund 3 or 4 out of 4 or 5. So again, low number, really high return rate though, right? And chance of getting funded. So we do aim to fund all qualified proposals. The other thing that we've done too, which is not typical of how the Dickey Center manages their awards, is that based on student feedback, we have said, we have heard, as I said, we rank proposals, and the top proposals we generally aim to fully fund them. But we heard from people that said, you know what, if my budget is say $2,000 and I were to get $1,000 or $1,500, I could find other sources, I could make it work somehow. And so they said, rather than saying we can't fund you, if you could partially fund us, that would work for us. So I'm just letting you know that that sometimes we, unlike other funding mechanisms, we will say we are able to fund you, at this level. Again, it depends on numbers of applications and resources that we have available. But just to let you know again that this is a little bit more flexible than others. And again, I agree. I'd rather try to offer someone partial funding and see if they can still make it work than to say, we're not going to fund you at all. So, okay. Next slide, please. All right. So application is online, right? I'm looking at Tekla now to see for the global internships, right? We've got it up. You can, I think you can get through it through the Global Health Scholars site. But Tekla, would you be able to just put the link in right now so everybody has it? And while she's doing that, I also want to share that we have a one-time funding opportunity. I don't know if this will appeal to any of you because you're maybe more global health oriented, but we are going to be advertising this across all M1s and to TDI students who are in the hybrid program. TDI, the MPH is typically 1 year long and they graduate in June, so they're no longer Dartmouth students over the summer. But we do have an opportunity to be able to fund the hybrid students because they're in a 3-year program. So it's just, we have funding for a domestic health equity opportunity. Similar application, it's similar principles, similar guidance, but it's working with a domestic partner. And there'll be details on it when we put out the call and share information, but just to let you all know that it really can be anywhere in the country, including in the Upper Valley. there was a preference for rural health focused and a preference for looking at the impact that the COVID pandemic has had, you know, if there's some way to tie that piece in, because this funding was initially for rural health equity and you know, addressing impacts from COVID. I'm not worried about that latter piece because I think every place, everyone has been affected by COVID. So drawing that linkage is not going to be hard to do. But anyway, so that's, I just wanted to highlight that will be another opportunity, and we will be advertising that with a call that will go out to all M1s. So again, the application, you'll be able to read it, see it. It's a couple short essays, nothing surprising there. You know, what are you hoping to accomplish? Describe the project. What are your motivation and intentions? What are your qualifications? And then the due date. Next slide, please. And then the Dickey Center opportunities that I mentioned, they are either research or internship opportunities with the pre-vetted established partner organizations. They there's a higher cap for those in terms of the funding cap. They have required 6 to 8 weeks, so that one, the budget may be adjusted based on how long someone's able to stay. I really think it's impossible for a med student to eke out 8 weeks, but you will see that on the application because they are actually geared towards the undergraduate calendar, and the undergraduates are expected to spend, and I don't know if it's 8 to 10 or it may be even 10 to 12 weeks. So that's why the funding cap is a little bit higher, because it's anticipating that students may be spending up to 12 weeks. And of course, the budget's adjusted accordingly, you know, based on expenses and time in country. Okay, next slide, please. Okay, and then I think I just shared some examples. Again, you can see what these are. So whether it was working with the head of the emergency department and head of or a leader for emergency preparedness in Lima, Peru at Cayetano Hospital, or a household, it was the analysis of a household survey that had been conducted on healthcare access by an NGO in Kosovo, work with our TB vaccine trials in Tanzania. So then just again, you'll be able to go on to the Dickey Center website and see what those projects are, the ones that are being offered, the ones that were offered for spring term. And as I said, that'll give you a heads up as to what you can expect for being offered for summer term. And I hope we'll be meeting with Dawn Carey from the Dickey Center and talking to her about when those might be updated, and hopefully in the next week or so. As I said, those projects may have, you know, be for pairs of students. There's benefit certainly for having a partner student. If you're paired with an undergraduate, it can provide an opportunity for some sort of peer mentoring by the med student, but also that undergraduate may bring a different set of skills to the table. If they're a social scientist and that's their area of study, again, it can be very complementary. And we do try to take all of that into consideration. So again, summer projects coming. Next slide, please. Okay, and similarly, it's this, as I said, it's almost an identical online application. The Dickey Center does require 2 letters of recommendation. I know this can be tricky for M1s because you know, have only been here for, you know, 6 or 8 months. So sometimes people have gone to previous advisors that they've had from work that they were doing before they came to Geisel, or even undergraduate mentors. So I think they're very flexible about where those are coming from. A lot of people use their on-doc supervisors, of course. And then, gosh, I have here supplemental materials, but I'm not even sure now what that's referring to. I think that may have been, we may not be requiring anything really beyond the online application and letters of recommendation. Again, deadline March 25th. And I say finalists are often interviewed. They have been pre-pandemic. An interview is part of the application process. I don't know if it's going to remain. Part of that too is that we had a very particular project that was around a health policy team-based project, and for that it was really important that with the health policy faculty advisor that interviews were done, but those are no longer offered. The person who did those is the faculty member is sort of retired from that part of his work. So I don't, I would say finalists may be interviewed. All right, next slide, please. So just a couple things to keep in mind. This is now, once you are selected, once you are funded for this opportunity, that there will be pre-departure preparation expected. We actually do a fair amount of work around this. So there is an online course that BU has prepared that we have used for students when it was impossible for them to participate in person. Of course, now everything's online. So what does participating in person mean anymore? It could be, we may be doing these sessions as through Zoom anyways, but we had, again, we're resuming this because we haven't done it over the last few years, but previously it had been an in-person session, often on Friday afternoons, not a great time of the day, but it was a time or a time of the week, but it was time when we could gather together. And the idea was just to go through what might be needed for research in terms of making sure that those doing research had their IRB certification, making sure that everybody was sort of thinking about, we did some sort of project management training with colleagues from Tuck. We did talk about ethical challenges that you might face when you're in the field, and then did talk about what might be specific to the country or setting that you're going to, whether it's going to be very rural or very urban setting, and used it as a time for making sure that people were just set with practical details for lodge. Has your lodging been arranged, or how can we help you with that? Has your transportation to and from the airport once you arrive? Have you set up your first, worked on a rough schedule with your host in-country supervisor? Do you have your plane ticket? Do you have your visa? Those kinds of practical details. So then, what we do ask for people is to do either a reflection paper or a presentation when they come back. What's worked really well is that for the med students is that early on when people are back, and sometime late August, early September, just to hold a lunchtime session. Hopefully we'll be able to feed you all by then. So provide lunch and then just have a very quick, people presenting over 5-7 minutes, one right after the other, just a kind of a speed presentation of their projects. And it's just kind of nice, especially for the new in M1s, to hear what students have done. And so the reflection paper is really more about what you gained from this experience. What did you take away, and how will that be important to you in your professional development as a physician? We do ask people to take high resolution photos with permission. Those will be important. We will, may select some to students and their internship opportunities to highlight on our website. If you're a global health scholar, you may want to highlight it on the GHS website. So we often forget about that, but one of the things we've talked about in the pre-departure prep is how do you ethically obtain photos in these settings? We may also, again, ask for summaries, text summaries that we could post on the Center for Health Equity website. And then we do expect you, while you're in country, to be in regular communication with your Dartmouth supervisor or the GHI staff, or it may be Tekla and me, just that there's some regular communication, so we can make sure that you're getting the support and mentoring from the Dartmouth side. All right, next slide, please. Okay, great. I was afraid I was going to keep on talking because I did fill in a lot, obviously, that I didn't get to when I presented on the that evening session back in November. So kind of wanted to fill in some of the details. And now we have until 1:15, right? So really the floor is yours. What questions do you have? Before I actually hand it over, Tekla, is there anything that you think that should be mentioned?
I think you did a great job. I can't think of anything.
Okay, just want to make sure nothing to add. All right, so yeah, happy to hear what you're thinking about or how we can help you with next steps in your planning. I will say sometimes
Hey,
people
Dr.
apply to both. They apply to the global health, the Dickey Center ones, and do a build your own for some parallel planning. Not impossible, but as I said, if you have your heart set on one or the other, I think that makes sense to focus on that. Sorry. Okay. Ian, were you starting?
Yeah, I'm sorry about that. I didn't mean to interrupt, but
No,
I was
no
just
worries.
curious to know. So when you said that the GHI and the already established programs, when that list is finalized, will that application be posted? Do you know, or has it already been put up somewhere?
Yeah. No, it will be. So the Dickey Center uses Teradata as their platform for going through the application process. It's sort of an online portal where you can actually, I think you fill out the application online. It might be something where you can actually, work on it, save it, come back to it. And then you can upload letters of recommendation. And that's really nice. And because the Dickey Center has a massive internship program that's for undergraduates, that's well beyond global health. And so they have this special software for managing all their applications. So that's, it'll be accessible, like when you get to it through the Dickey Center GHI website, that you will be able to put in your application through the Teradata system. But again, if you go to what our application is, it's very similar. In fact, I don't think it's changed at all in this since Dawn Carey, who has taken over at the Dickey Center in a relatively new role. She started last summer. So I don't think it's changed in the past few years. So it should look pretty much like our application because we based ours off of theirs.
Great, thank you.
Yeah, and ours is just you fill it out and you email it. and you will have a page for an in-country supervisor to sign. Electronic signatures, of course, are fine, or if they can't do that, just have them return it with an email that says, yeah, or write in their names. And then similarly, there's a Dartmouth supervisor page. So, if you can combine them into one document, that's great. But if for some reason that's challenging and you needed to email it as 3 separate ones, we'll work on the compiling.
Okay, I'm sorry if I missed this, but so the build your own one is the one that you're talking about right now. And that, where can we find that application?
Is that the one that it's on the in the chat?
Okay, so I opened that and I clicked on the download application form and it linked me to a domestic health equity one. And I just wasn't sure if there was a separate one for an international application.
They are similar, but we'll figure. Yeah, go ahead, Tekla.
Yeah, thanks for catching that. They must have uploaded both to the same one. We'll fix that.
Okay.
Thank you.
Thanks.
Okay, awesome. Thank you.
But it also will look very similar. It'll say global instead of domestic because the questions are pretty much the same. Yeah, and then Connor, I think you touched on it earlier with regards to partial funding, but would it be possible to combine this with other funding opportunities? Absolutely. No reason not to. So if you have funding from other sources, if your budget's, $3,000, we're only able to fund you at $2,000 and you have other sources to bring in the additional funds, yeah, that's absolutely fine. we will distribute our funds, and then whatever else you bring in on top of that, whether it's a formal other funding opportunity. The one I think you can't do, and I think this is on their side too, there's something called the gold humanism, or is it humanitarian? I think it's actually humanism, the Gold Foundation. And I think they will say you can't combine this with other funding. Now, if you were to get funded, if you applied to ours and got funded, and we've had this happen, and then we had a student apply to Gold, they got funded actually at a higher level than we could offer them. And so in that case, they were able to return the funding to us because they were overfunded. They had the full funding from Gold. And so they did actually say, I don't need your funding anymore. So we would ask people to do that. Of course, we're not going to check up on people, but hopefully that would be obvious how to respond. If you are using it to fill a gap in funding, that's absolutely fine.
So for the kind of like pre-established projects that we have, with the application being due on March 25th, I know right now we're only seeing the listings for the ones that we're going for the spring. Can we expect a time frame for when those will be updated?
Yeah, as I said, I will be talking to Don Carey in the next hour, and hopefully it will be, we'll talk to her. And I imagine she's having students ask the same question, the undergraduates asking the same question. So I'm really hoping it'll be in the next week or so. So, do people have ideas about which one they're thinking of applying to? Or I know when I met with students after the November meeting, some had already identified places that they wanted to go work. Oh, and I know too, people had asked me in that session, and I didn't address it here, about group projects. Can they apply as on the build your own as a team or a parent? And yes, that's absolutely possible. You would want to make sure that you clearly explain, justify why this is going to be better as a team project, and the different roles and responsibilities that the team members will each have. Anything else? I mean, I'm happy to say if you do have questions, you can certainly email Tekla and me any questions that you might have, and we'll be happy to respond.
Thank you so much. This was really helpful.
Okay, great. I hope so. I mean, again, I think this is very exciting. I'm thrilled that we are resuming this program. I think it's been one of the highlights of many a student's time at Geisel, and so we're really pleased to be able to have it resuming. And the other thing too that I will mention, that I think is mentioned on the Dickey Center website, is people have asked too, can I do it? What about a remote internship? I just, I can't get into, I don't know, New Zealand. I don't know what other countries are keeping us out. Those are possible. Obviously, they're funded at a slightly different level because there's no, housing or airfare involved. But those are certainly possible, and I wouldn't discount them. They can be certainly very rewarding. But I think probably everybody, I certainly know I am, is very eager to get back to in-person interaction in every way, shape, and form. So being able to travel to the site, meet with partners, work out with the community, work directly with the community members is great. The other thing too that I should mention, which will be critical, is if you are applying to go to a country that is not on Dartmouth's green light list, you would have to apply for a travel exception. I think, you know, if you are, you have a good thought out safety plan, and we can talk more about what that might look like. We have 4 students slated to go to Tanzania in March. They all applied for travel exceptions. All 4 of them were granted the exceptions. There's advice with each exception that says, make sure that you register in the ISOS program, make sure that you, and this would also be something covered in the pre-departure training or sessions, because that list is going to change. Some countries are going to come off that list. Some countries, hopefully many more countries, are going to be added to it. So that's something else to keep in mind. There's also, if you are, and I think the language is going to change. It had been if you are unvaccinated. I think it's going to be if you are not up to date with your vaccine, meaning completed a primary vaccine series and a booster. For any international travel, you would need to apply for a travel exception. So again, that would happen at the, great, I've got a, you know, project in mind. I've worked with host partners. I can travel, you know, that they will accept me in country. And then, you know, then that's part of the logistics and planning piece that happens in the pre-departure preparation. Great. Does everybody want to get 15 minutes back to where you need to be in class? No problem, Shabi.
Thank you so much, Dr. Adams and Tekla.
Yeah. Very welcome. Have a good afternoon, everyone.
Bye.
Thank you.